I was exposed to the technology in 2007 and started researching it and learning all about pulsed electromagnetic fields and studying the legitimacy, reviewing all the studies, and it's extraordinarily compelling. You know, when you start studying this stuff, it really kind of makes you think as a physician very differently. You start considering that the cause of disease could fundamentally be electrical, and then you start cogitating over all of this and then looking at the thousands of studies that have been done and how mature the technology is in Europe over the last 30 years. And it was enough for me to really seriously consider it. I was a little resistant, a little skeptical, not sure of exactly what the technology was at first. But once I got involved with it and started using it, the results are extraordinary. Although I teach cardiology and pulmonary medicine, in my first 15 years as a doctor, I did a lot of personal injuries and work comp. So I would do spinal manipulations on patients and used ultrasound and sign technology, electrical muscle stimulation, current, hot packs, you know, all the physical therapy modalities. After being exposed to PEMF, this is hands down dramatically more effective in reducing pain and helping patients improve range of motion and rehabilitate their cell structures. It's pretty phenomenal. If I were to do it all over again, I'd throw out all the other adjunct electrical stimulation devices and replace it with PEMF. If you think about it, it does everything you would want a mechanical device to do. It exercises cells. It improves nutrition into the cells. It helps remove waste products of metabolism. It donates electrons, which means it's actually an antioxidant generating machine. There's no single device that does more to rehabilitate cell structures than this. So if you're going to start somewhere, you might as well start with something that's affecting the cells and tissues in so many beneficial ways all at once. It's phenomenally versatile and does really more than any other individual device I've ever come close to practicing with. Well, nutrition is ultimately a cellular intervention, meaning if you adjust what people eat and they absorb it and they get it through their gut into their bloodstream, they then have to get those nutrients into their cells. And one of the biggest rate limiting steps in getting nutrition from your gut to your blood and from your blood to your cells is the health of your cell membrane. And if your cell membranes aren't charged properly, you're not going to get that nutrition in. It's literally a wall obstacle to cure with the best of nutritional intention. And we do body composition analysis on all of our patients, and optimal is about 1,000 and most people are at about 400 or 500. And that means that their cell's abilities to maintain charge is 50% of what it should be. So if you give somebody an optimal, pristine, 100% correct diet, and those nutrients are going from the blood through cell membranes that are operating at 50%, your nutrition just isn't working as well. So if you recharge their cell membranes and rehabilitate their cell structures, your nutrition is going to work much better. And that's what we see. And we have our clients come in and try the technology for just 6 to 8 minutes and grade the intensity of their pain, and if their pain's at an 8, after just 6 to 8 minutes their pain dramatically reduces in about 60 to 80% of the cases. So that grading of 8 will drop to about 4, and it's incredibly reliable and consistent, and there's no technology that I've come close to seeing that has that level of efficiency and consistency in being able to dramatically reduce pain. So it's a natural for a chiropractic practice to just incorporate for everyone where they're treating musculoskeletal pain and spasm and those types of problems. So you see case after case after case of people having chronic intractable situations that dramatically improve with short order you know, 1, 2, 3, or 4 exposures in it, you know, it kind of shakes your head and goes, what's going on with this stuff? You know, this stuff's amazing. And that was my early experience. Is because no other technology rehabilitates cell membranes and recharges them and adds electrons as an antioxidant and exercises the cell structures and reduces pain and corrects the charge of a cell. There's nothing else that does what this does. There's nothing that even comes close. And the technology that I use comes from a company that has spent a tremendous amount of time creating tools and resources to make training very easy. But the technology is really easy to use. I mean, the loops are pretty straightforward and they're versatile and they cover all regions of the body. It's really very easy. You can be comfortable after 1 hour and expert after a day and handle 85% of the problems. If you bring in the technology and it helps people as much as it helps people, and the word of mouth response is as extraordinary as it usually is, it is not only an antioxidant electron donating machine, it's a referral generator, literally, because people talk. It's a unique technology, it's extraordinarily effective, and they refer others to your practice, and it's going to benefit you one way if not the other. When you clear away all the hype that technologies expose doctors to, and you get right down to brass tacks of what the role of a physician is, it's to help his patient heal. You can't get to the point of seeing a technology that's this effective and helps people as much as it does and morally say no to it. If you're saying no to it for economic reasons because of the cost, that doesn't make a whole lot of sense, because what builds people's practice the most is getting people well and word of mouth and being great at what you do. And if you have an adjunct technology that you can incorporate into every chiropractic session and every massage session, that's going to significantly improve your outcomes, that's your best insurance policy for successful practice. So from that perspective, it doesn't make a whole lot of sense not to say yes to the technology.